Good morning.
Good morning.
Morning. Good morning.
Morning. Morning.
Morning. Okay, guys. We talk about here. Now, before I start, any questions? Okay, guys. So I think we're done with pretty much all the O's that we could talk about. Clear? Is there any O's that anybody wants to ask of? What did O's mean? Well, the cis mean is okay, just makes it yes, okay. Conditional state. O just makes that an abnormal. Okay. Now we can just chalk off. Oh, yes, okay, one that I probably didn't mention. Yes. It's what we'll call stenosis. Okay. Maybe we can say it's okay. O main indicator this whole thing here is going to be as okay an abnormal state or condition. And what the word stenosis or stent actually is okay or mean is narrowing. Yeah, okay. Now, guys, usually that's okay when we talk about narrowing or stenosis. That's mainly going to be as okay referred to when we talk of any tubular passage or structure, which okay, yes, at some point it's okay that its outline or passage actually is okay, it get narrows down. Yeah, okay, and that narrowing, that's mainly as okay what you would call stenosis. Okay, now where is it that we come as okay, most likely as okay, we'll see stenosis is going to be as okay in blood vessels. Common reason for this narrowing here in blood vessels is atherosclerosis, which you always said was okay at that accumulation of fatty plaques. Okay, that mainly cause that, okay, yes, the blood vessel becomes stenosed or stenotic due to stenosis. Okay, you may have incidences, but okay, yes, you have a passage, but where the actually it's okay will be a structure right next to the passage that either is okay because it physically shifts, causes it's okay, puts pressure on the passage, meaning it's okay to cause it to narrow down. Or it's okay if a structure here right next to a passage grows in size. And due to that, mainly it's okay causes the passage to become narrowed down, or what we as a whole could call stenosis. Did you guys get that? Any questions? Okay, so stenosis, that's going to be a term that you will, see a lot of, especially it's okay when you go for your vascular. One of the major issues that you'll come across is going to be stenosis. Next or next? You can say patty. We know the word pat was disease. Okay. The Y here means it's okay, this becomes it's okay. Process. Now you may have okay, it's a bigger or longer list of okay, yes, patties. Mainly just because okay, they may come as okay, they may be known by the name this patty, that patty, so and so. But I just want just okay, just give you a list of three patties. Now retin comes from the word retina. Ren comes from the word renal. And nerve comes from the word nerves. Yeah, okay. And why did I mention these three pathies here together? It's mainly that they are, you can say it's okay. Common complications of what we call diabetes mellitus. Okay. That may as okay affect the retina in your eye. That's going to affect your vision. It may affect as okay your kidneys, and it may as okay affect your nerves. Okay, so these are as okay what officially is okay say are the three common complications of diabetes mellitus. Okay. I think we already as okay talked off as okay the word patty or pat in the previous chapters. Any questions, guys? Okay. So otherwise, okay, the word path is pretty much okay as a type of a vague term. RIA. Okay. Which means yes, okay, just means flow. Usually it's okay if something flows, that's because it's going to be, we can say it's okay, discharged. So we can mainly say it's okay. Diarrhea. Okay, where we know that the word dia means complete. So mainly it's okay, a complete discharge. Okay. That's how it's okay. The word diarrhea came into being, but okay, what we now know diarrhea is going to mean is okay, just mean loose motions. The other day, we, for instance, it's okay, said man. Oh, yeah, but just keep in mind that, okay, here the O is, that's okay, you combine it out. That will mean is okay, just for say it's okay, that's going to be the regular word for menstruation flow. Okay. If we put an A in front of it, then that A would just mean no menstrual flow. Okay, whereas okay, we put this in front of it. Yes, okay, the this mean is okay, what mean is okay mean painful menstruation. Okay. Whereas okay, sorry guys, do you mind if I go to another slide? Because if we mean it's okay, just change this RIA out. With rage, then that becomes just okay. Maybe it's okay, you can say bloody discharge. Now, if you just look at the word, so hemorrhage, maybe that's okay. Okay, that's okay. Okay, it's just okay. Bloody discharge. of, let's see, of blood. The hemorrhage, guys, is just going to be as okay a general time, which means it's okay just for me bleeding. So whenever you see somebody bleeding or referring to bleeding, hemorrhage will be a technical term. Okay. I think I mentioned that the other day, but okay, yes, that's fine. Because it's okay, man. Outrage. Okay, this is me, it's okay, just going to be, it's okay, what we can call this, okay. Excessive. It's okay. It's okay, menstrual. Bleeding. Or what some people just may refer to as heavy menstruations.
What is that word under hemorrhage? Hemorrhage?
Hemorrhage,
Yeah, and the next one.
bloody discharge of blood. If you
Thanks.
looked at it, that's mainly it's okay, what do we mean, right?
Mhm.
Okay, because rage means it's okay, just for me, it's okay, discharge of blood, bloody discharge. But then, okay, the word hem itself will mean blood. Did you guys get that? Now, guys, term where we will say is okay. It's going to be your, and we can say yeah. Yes, okay, the word yeah just being that okay, this term that we come up with will become yes, okay, the name of a condition. But here is okay, the word your is going to refer to urine. So together we can mainly say the urea, URIA, or urea, become yes, okay, condition. We can say it's okay. Involving or let's say like the condition of the urine. Okay, now the other day in class we made a word uremia, where I said that okay, here is okay, this word mean urea and amia mainly is okay. M was blood. And he just yes, okay, made it a condition. Okay. But where we is okay, when we mean it's okay, take emia or that's okay together, that's okay, what that becomes, that's become as okay, a condition of blood. Where you say urea or urea, it becomes as okay, a condition of urine. Okay. And somebody did what I wanted to, said that okay, this would mainly they thought that that mean the presence of urine. in blood. Okay. And the presence of urine and blood actually becomes is a condition of urine. Okay, it's going to be a condition of urine. So that means for me that it has to end with urea. And that's when we mean just put a term for blood, which will be hemat. So hematuria is what you mainly refer to as. That's going to be presence of blood in the urine. Okay. Okay. Where here you can say, this is blood. Or you can say this is blood too. The word "your" here is sounds pretty much PP alike. Okay, so does this. And E is here, right? Okay. E just indicated, as this is a condition. But please, make sure that you be able to distinguish uremia from hematuria. Okay. This thing here mostly happens in kidney failures. Whereas hematuria can mainly happen either if somebody has kidney stones, urethral stones, some infections may cause it. Okay. Even things such as tumors, most likely as in the bladder or the prostate and so on. So it's will lead to hematuria, which will be as the presence of blood in the urine. Did you guys get that? But just like yes, you can have blood in the urine. There will be other things that you also may find in the urine or in the PP. So all those phenomena that's where we find something in the urine is going to be ending with a urea. Did you guys get that? Okay, so your urine-EA condition. So a condition involving of the urine. Okay, emia, condition of blood. So mainly as either something found in the blood or something as either related or wrong with the blood in one way or the other. Okay, because if there's nothing wrong with it, then it will only be a condition. Yeah, okay. So, what else do you think you can find in blood? No, sorry, not blood, sorry. Urine.
Protein.
Huh?
Protein.
Proteins, very good. Okay. Oops, shit. So that becomes just proteinuria. So that's me just that's going to be protein, and we can say in the urine. Okay, so presence of protein in the urine is what you would call proteinuria. What else? Yes, guys.
Ketones.
Ketones. Okay. No, it's ketone, but they mean yes, okay, we can say, okay, eliminate these, so that becomes what we can call it, okay, keto. Okay. Before you get ketones in the urine, what else can you have?
Bilirubin.
How many?
Bilirubin.
Okay. Now, where does bilirubin come from? Now, bilirubin, I mean, yes, okay, it's just a breakdown product of hemoglobin. Ideally, yes, okay, that should be secreted in your bile. That's why bile is called bile, because the major ingredient in it is bilirubin. But due to one reason or another, yes, okay, you may not be able to, yes, okay, secrete that into the bile, and that case, okay, goes in the blood. And from the blood, yes, okay, goes to the
Bacteria. Can you find bacteria in the blood? I mean, in urine?
yeah, you can have.
And stones, is it the same thing as ketone? I don't know.
No, that's going to. Okay. The stones mainly, yes, okay, will be, yes, okay, you can say related to, yes, okay, the area where it's found. So that'll be, yes, okay, nephrolitis, cystitis, things like that. OMG. Glycosuria. Now here, yes, okay, guy. The glycose is, may, yes, okay, derived from the word glycogen, which becomes glucose. Yeah, okay. So the presence of glucose in urine is what you will call glycosuria. And where do we see that? Where and when will you see somebody with glycosuria?
Someone with diabetes, or maybe someone pregnant.
Diabetes, exactly. Yeah. Now, have any of you ever list that's okay, chart of the, no, Michelle, you call it diabetes, right? Good.
Yeah.
But that's just the short name for diabetes mellitus. there are two forms of diabetes, not type 1 and type 2. I'm not talking about that. But there's something that we call diabetes insipidus. And then we have diabetes mellitus. I know you haven't heard of the first one. That's okay. Okay. But how was it that they gave, yes, okay, the word mellitus to diabetes mellitus? That 99.9% of the population are just referred to as diabetes. No idea. Nowadays, how would they check if somebody has diabetes mellitus?
I mean, through the blood or maybe urine? I don't know, because we're talking about urine, but maybe blood, no?
Well, nowadays we do blood tests, right? Okay, but why would they say, okay, and we need to, yes, okay, get you check on your blood sugar as well? Mainly because on a regular urine screen test, they find high levels of diabetes. Nowadays, that's okay, we have test strips. Back in the days, there was no test strips, so they actually had to send that specimen to the lab, where the lab will run different tests and determine that, okay, yes, there is a presence of sugar in the PP. Now, before they had those tests, okay, to check whether there was sugar in the urine or not, how would they know that there was sugar in the urine?
Maybe by the appearance of the urine?
Okay. Good guess. But unfortunately not correct. Because when you say appearance, what do you mean? That, okay, as if it had sugar in it, would be darker in color, lighter in color? Now, okay, guys. Not sipping off it, but me, okay,
They would
taste
take,
it. And because you, and that's why I say, yes, okay, you don't sip it. Don't drink the whole sample. I say, okay, well, okay, where did the whole, okay, where did the sample go? We still need to, yes, okay, check for other things. But mainly, yes, okay, that's why, tastes sweet. So the word mellitus actually, yes, okay, means honey. So honey is sweet. So that's why it's okay, it's okay, that's from where it's okay, the word diabetes mellitus comes from. Because those people were producing sweet urine samples. Did that make sense? So there's always okay, a crazy story behind. That's okay, how things might have got their names. Good. So yes, okay, glycosuria would be presence of glucose, as we know it now, in the urine. Did you guys get that? Okay. Good. And that's probably why it's okay if a lab says, well, okay, you need to, it's okay, collect a 24 urine sample or 24-hour urine sample. You better, it's okay, you're most likely, it's okay, like to label that in this container, it's okay, it's not lemonade, but it is urine. Otherwise, it's okay, your urine sample may be, okay, that's not good there. But yes. Okay, but what else can you find in the PP? It just become okay. Huh?
Leukocytes?
Okay. Are you guys Googling
No.
okay. Leukocytes, okay, good. Okay, guys, just the last one. And again, it's okay, something that you haven't thought of.
I'm sorry, what does it say?
Pneumaturia. So what does your here is? Urine. Yes, okay, condition in which there is and what is pneum?
Air or lungs?
I don't think you have okay.
Air? Didn't you say
Air.
air? Airway? Yeah, air.
Air in the PP. And some of you say, okay, where in the blue did that get there? How in the blue did you get air into the PP? Where did that come from? No idea? Okay, guys. Let's look at it. And we most likely, yes, okay, we'll talk a bit about it's okay, some similar phenomena to this in just a little bit. Well, it's okay. In the anatomy, it's okay. We can say it's okay whether it's a male or a female. This is your bladder. Okay. What all of us will have running is okay behind the bladder. Because it's okay, we part of okay, yes, the colon or intestine. Now, what may happen is that there develops just okay a connection between the colon and the intestine. And besides, okay, fecal matter, which also is okay, may it's okay, tend to yes, okay, enter the intestine. Oh, sorry, bladder. But what you also yes, okay, what also may enter from the colon is what otherwise might be released as okay as a fart. Why is okay that area is okay may enter the bladder. And okay, as when somebody is okay, eventually is okay is going to be peeing, what you will actually see is bubbles of air in the pee, and that's what you call pneumaturia.
So that doesn't happen to like a person that farts a lot, right?
No, it has nothing to do with that.
Okay.
Okay, that's not getting into as okay what causes this. Okay, because okay, this is not going to be as okay. This is going to mean it's okay be an abnormal connection between. It's okay there's okay two hollow structures here. Okay, so this is not normal. Okay, but it can happen. But before yes, okay, somebody starts yes, okay, seeing yes, okay, bubbles of air in his or her urine, what they actually is okay will experience a lot of is pretty much as okay, a lot of UTIs, that the UTI just keep on coming back. Why? Because of the fecal material in the bladder. Did that make sense? Okay. But okay, as just in a little bit, it's okay. We will talk about what do we call it? What you call is okay, this connection between is okay, two body structures, or let's say it's okay, the any body structure and the outer environment. Any questions, guys? Right. So here, when we say pneumoturia, it's okay. It's not going to be lungs in the blood or in the urine. Okay. But rather, it's okay here. The word pneumo would mean ear. Did I make myself clear? Okay, guys. And okay, then your book mate is okay. This talks about it's okay. It's okay. Adjective suffixes, but mainly it's okay. Ik, ari, al, il, are, so and so. And one ik that's okay. Just one, two, it's okay. Talk with me, it's okay. Still me, it's okay. Pertaining to is going to be it's okay when you put the word chron, which is okay refers to time. Yeah, okay. And then mainly it's okay, just makes the word chronic. Okay. Now, usually, guys, whenever it's okay, we talk about different conditions and so on, so on. So you may hear somebody say, well, okay, somebody is okay, is suffering from chronic XYZ. Well, okay, we can just be as okay, whatever condition. But what does the word chronic actually mean? In this context here, it can mean two things. Either lasting for an, because it's okay, prolonged period of time. So something that the patient may have been suffering from, okay, whatever condition, or okay, as a prolonged period of time. Okay. Now this period of time here is okay, is going to be as okay individual for as okay, whatever condition you're talking about. Okay. Another way, another case is okay, where we may use the word chronic is we can say it's okay if it is a lifelong lasting condition. Mainly something that okay, as once you get it, well, okay, you're probably not going to get free of it. Okay, but otherwise, okay, something which might have been yes, okay, lasting for more of a certain period of time, yes, okay, will be referred to as chronic. But literally speaking, yes, okay, when we look at the word chronic, it means yes, okay, just pertaining to time. Or guys, you may have heard the word chronic. Or if I come and see yes, okay, 2 or 3 of you, yes, okay, arguing, I say, okay, listen, guys. And it's going to be, yes, okay, he said this and she said that. I say, okay, listen, guys. Give me, yes, okay, detail of the event in a chronological order. So what I mean, okay, is what happened first, then what happened next, then what happened next, then what happened next, what happened next. Yeah, okay? Or in a timely manner. Only then would I be able to say, okay, this is going to be as okay. He or she is probably as okay the one that's responsible. Or me as okay carry the guilt. I can get this probably. Okay. Did you guys get that? So usually as okay, we use the word chronic mainly as okay to specify as okay when talking about conditions where if it's something which has been lasting for more than a certain period of time, or if a condition most likely is going to be as okay everlasting as long as the patient is living. Yeah, okay. Now the opposite of chronic. Okay. Because says okay, means okay, will have means okay, long lasting. Opposite of chronic is going to be acute. Yeah, okay. No, actually, that's okay, one word. So what do we mean to be acute? Happens suddenly. Okay, in most conditions, that's okay, which happens suddenly or develops suddenly will be referred to as acute this, acute that. Yeah, okay. Or we can even say as okay, something is okay, which has been lasting for a short period of time. Yeah, okay. Again, it's okay. With that said, it's okay. You may have somebody, it's okay, who suffer from a chronic condition. Rheumatoid arthritis, for instance. But what is that he or she, as okay, may get? It's okay, acute attacks or acute exacerbations of that condition. So that's actually going to be as okay, what we will call as okay, acute on chronic. Which means, okay, he or she suffers from a chronic condition. But when it is okay for a short period of time, or you have okay, that it suddenly is okay, just becomes severe. His or her symptoms is okay, actually is okay, becomes severe in intensity, or that's okay, exaggerates and so on. So that will refer to as an acute or chronic. Did that make sense? Just put it this way. In the winter, yes, okay, it's generally colder, right? Clear? Okay. Well, what do you get during the compared to as okay? Are they generally cold or winter? They're going to be as okay 2 days here, 1 day here, 3 days there, where the temperature is like completely. Okay, forget about going out. Let's put it that way, okay? Those guys. So you guys says okay? Okay. Worsening of the cold weather. All that's okay. It was 3 months of okay as the cold season or whatever. But these 2 days, these 3 days, that 1 day, so on, so on, so it's like it was like hell. Did you guys get that? Yeah, okay. And if we had winter all the year round, well, okay. Okay, lasting for a long, long period. That's okay. So acute mostly is okay thing that happens suddenly. That's why you may say the word. Now people just tend to just say it's okay appendicitis. But the actual term is going to be acute appendicitis because it happens suddenly. Okay. Okay. Either it goes away in a day or two, or it's okay, it just would be lasting. Or usually it's okay, they would take it out. Anyways, okay. Acute myocardial infarction, heart attack, right? Okay. Why would they call it an acute? Because it happens suddenly. Okay. So that's why they call it an acute myocardial infarction, but just the opposite to chronic. Did you guys get that? Okay. And then you may hear as okay, acute on chronic, which will mean because says okay, would be as okay, somebody suffering from a chronic condition, but in which there is going to be acute worsening of his or her symptoms. Okay. COPD. Okay. Have anybody ever heard of COPD? Chronic obstructive pulmonary disease. Yep. Now, when you say chronic, what does that tell you? It's been lasting for a certain period of time, right? Okay, here the time is 2 years, at least for 2 years as the patient have had, that's okay, bronchitis. Okay. So, but as okay, if he or she is known with, okay, as COPD, but he may have, or he or she may have acute attacks of worsening of his or her bronchitis or COPD. So that'll be as okay, acute on the chronic. Okay. Now, whether you use R, ARI, EL, IL, L, it's mainly as okay, just a matter of okay, yes, for it to yes, okay, so sound, yes, okay, chick or sex. Should we just take a short break and okay, when we come back, we can talk about yes, okay, some of the procedural suffixes. Okay, now you may realize, okay, most of them we already have done. Like all the ectomies, I don't think, unless somebody wants to just, okay, talk about, okay, weird ectomy, I don't mind. But, okay, but a lot of them, yes, okay, we already talked about. So, okay, I see you guys back in, should we say 10 minutes? So 10. Okay, guys. Good. Okay, guys. So suffix or suffixes. And the ones that we will talk about here is going to be procedural suffixes. Now, what does the word procedure mean? A procedure mean that it's going to be okay, we guess it's okay. Pertaining to procedures. Okay. Now, one thing that we know that, okay, most procedures will stand with or end with cis. And that's what we see in the first one, which is going to be sente cis. Okay. Me, it's okay, this bit down, it's okay. The procedure of, where we can say it's okay, that the word sente will mean it's okay. Of reference, it's okay. Surgical puncture. Or in some instances, okay, they may even it's okay, just refer to that as aspiring. Now, guys, sentences, whenever it's okay, it may be performed. Okay, guys, that is going to mean it's okay. You can say it's okay. You guys, sonographers will be involved. Now, an example of a synthesis. We can say it's okay, thorac, O synthesis. Now, yes, just so you guys know that, okay, the word thorac here is okay, came from thorax, which means chest. And what we mean is, okay, do on a chest, when we say it's okay, that we do thoracosynthesis as mean, that's okay. Inserting is okay, a bigger, smaller needle into the chest, mean it is okay to expire or, because it's okay, remove fluid. Okay, but that fluid removal is happening, or fluid, yes, okay, from the thorax, that will be called thoracosynthesis. Okay, commonly used in case, now all the guys here is okay, it says thoracosynthesis. Okay, what we mean is, okay, can say for sure the common areas, okay, from where the fluid would be removed is from, is okay, from the pleural space, or from the pleural membranes. Okay, so generally it's okay, they can call it as okay thoracocentesis. But they may even as okay be specific and say as okay pleurocentesis. Where here you can make that actually more specific that they mean it's okay talking about is okay remove fluid from the pleural cavity or pleural membrane. Yeah, okay. So where would this be done? Mainly as okay, we talk of okay, as we mentioned that we said pleural effusions. Okay, accumulation of fluid in the pleural membranes. Another synthesis. And we can say amnio. No, that's okay. This is okay. Yes. Synthesis where this just for conscious okay, even if it's okay. Surgical removal by mainly that's okay. Aspiring or puncture. But what is that we are removing here? Amni. We may as okay come from the term as okay, the against is okay. In this case, will be amniotic fluid. Where the amniotic fluid, the thick here actually is just going to be as okay pertaining to. So where do we find this amniotic fluid? Mainly it's okay within the, it's okay where we can call it's okay the amniotic sac. So, okay. And that's mainly it's okay where a fetus, sorry, to begin with, is going to be living. So this whole thing is okay, was found inside the uterus. So there may be, yes, okay, instances where, yes, okay, that they may have to, yes, okay, perform what they call, yes, okay, an amniocentesis. Okay, now this one, there's no doubt, guys, okay, that has to be done under ultrasonic examination. Because, okay, you don't want that needle to go too far and hook the baby or the embryo, if you may call it. Okay, so just to make sure that, okay, the needle is just far enough in. That, okay, it means, okay, just have the chip in the areas, okay, where the amniotic fluid is found. And, okay, as they take a specimen. Okay, now, although it's okay performed under it's okay ultrasound region, but still not free from risk. Okay, so there may be as okay an increased risk of things such as miscarriages, if that's what you want to call it, or it's okay an abortion occurs, so on, so, or it's okay even it's okay intrauterine death. So you can always argue as okay there should be as okay a solid reason why this procedure is going to be performed after all. Okay. They may as okay primarily do it for as okay testing for certain conditions that okay we can say that a newborn child is okay maybe at a risk at. Down syndrome is, for instance, okay, one of them. Okay. So, okay, guys. Now, if you could take, yes, okay, fluid from the pleural membrane, that's okay. You can also say, that's okay, take fluid from the pericardium. Okay, but that's just going to be called cardiocentesis. Okay. Yes, okay, here's okay by the word cardio. Yes, okay, what they actually will mean is the pericardium. That sac, we just actually, okay, so around the heart. Okay. And if you for instance, okay, yeah, okay, yes, and it's okay, excessive amount of fluid in this space here is okay, it can be as okay aspired via procedure called is okay cardiosynthesis. Okay. What else can we have? Now, guys, as we said, it's okay the other day for let's see, CSF, cerebrospinal fluid. Now, the common area is okay to maybe it's okay just to obtain a specimen of CSF is mainly as okay when we did a lumbar puncture. Okay. So although it's okay, it was, it's okay. You can say it's okay. Function is okay, the meninges to obtain is okay a specimen of CSF. But commonly it's okay, it's called a lumbar puncture. Okay. But here it's okay, it means it's okay to obtain a specimen. Mainly it's okay to send off for tests. Now, guys, there are going to be instances where it's okay, where you may it's okay due to one reason or another, may to have a more of a extended drainage of the cerebrospinal fluid being carried out. Okay, so what they may do is actually it's okay do that through the skull. Okay, so you can actually say okay, a way of okay as draining CSF can also be as okay what you can call would be cranial synthesis. Okay, but right here is okay that aspiration of the cerebrospinal fluid is mainly is okay by synthesis is okay through the skull. Okay, where the main is okay, this plays a bigger or smaller tube into the cerebrospinal or entry is okay the meninges through which okay as the cerebrospinal fluid is going to okay be drained out.
In what cases would they do that instead of the lumbar puncture?
Because lumbar puncture, my dear, well, okay, you can't leave okay as a needle this long in there, right? Okay, it's going to be needle in, tap off, okay, 3, 4, whatever amount of cc's, and then needle out. Okay. The case is okay where they may is okay use of more of that, yes, okay, boring a hole. is in cases of, severe concussions, swelling of the brain, things like that. Or yes, God forbid, initially, yes, when there is a blockage in, let's say, the circulation of the cerebrospinal fluid. So maybe it's just to avoid it from accumulating inside the skull and very much yes, squeezing the brain or choking the brain. That's when they may do this. Okay, but it's not something that is going to be commonly practiced. Okay. I just happen to see a lot of it because for a year worked at a neurosurgical unit where we had as an intensive department as well. So that's a lot of people has some bad concussions, or even as after, let's say, as operating on brain tumors and so on. So that would be as swelling of the brain itself. So that causes as there's less room. So the only thing that would be that would be able to drain, be able to drain as means to reduce the pressure in the room was the cerebrospinal fluid. Okay. But it's not just a matter of just to drain it, but also it's to measure the pressure itself. Okay, so way by which it's we not only just drain the excessive amount of cerebrospinal fluid, but also were able to measure the pressure inside the skull, which we call the intracranial pressure. So you don't want it to get above a certain level. So if it starts to get above that certain level, that would mean it's that's tell us why is it that the patient now is deteriorating? So that would mainly mean increase the drainage. Okay. But mainly because yes, we did that through big or small, yes, borehole in the skull. That's that's why they require craniocentesis. Any questions? Nope. Good. Okay, guys. I guess and the next word in your book is ectomy. Any ectomy that you guys still think that needs to be discussed? Now, guys, just once, and I will say it's maybe, but this time it's the last time. I said yes, the term ectomy was made up of two words, which was tomy, which meant cutting into, and here's the word ek or act meant out. Okay, so literally it's the word ectomy actually is meant to cut into and take out. Or what we mean is we'll just say it's removal. Removal of, right? Okay, removal of what? Yes, whatever was the root word. Okay. But then I also said that yes, there was another word that meant the same, which is X. And then we say it's cision. Where the word excision means, yes, okay, this gain is okay, meant to cut into. And where the word X would mean out. So you yes, okay, the word excision will mean yes, okay, cutting out or removal of. Did you guys get that? And if we say that the word X means out, and there's going to be a word here. And my question would be, yes, okay, what else can be taken out? Where it doesn't necessarily need it to, it doesn't necessarily need to have a cut. And what is that X going to be then? What else can be taken out? Well, okay, yes. But you will not use the word excision or ectomy for that structure. Because the mechanism of removing it or taking it out is going to be not cutting out, but rather
Aspiring, like removing some like fluid. Is that what you mean?
okay. You just said okay sentences, but
Yeah.
okay.
Are you talking
That's-
about the ectomy?
Huh?
You're talking about ectomy, but with not with EC, just tomy. I'm confused.
No, I'm asking what could be another word here
Instead of ectomy.
instead of tomy.
Oh,
Because the word that we will end up with is not going to be as okay necessity by cutting. So if you just think of okay as what can be removed from your body without an incision or a cut being made.
Extracts.
Huh?
Oh, extract. Oh.
Who is speaking?
Me, Asma.
Asthma, exactly. And who or where extract and what do they extract? Teeth, right? Okay, you should have had a pretty bad oral hygiene if you were extracting teeth. So let's just go with tooth. But if you look at the word X, still means all right. But when they extract a tooth, what is it that they do? Extract is just a fancy word for
Pulling it out, taking it out.
huh? Okay,
Pulling
but
it
how
out.
did they take it out, my dear?
They pull it out with tools.
Huh?
Pulling it out with tools.
Okay, they're using tools to do what?
They're taking it out by the root, right?
They make an incision
No.
to take it out.
I need to get this tooth here removed. They don't need to make a decision. They just go to Home Depot. Probably not.
Home Depot
Yeah.
to take
Have
out a
you ever
tooth?
seen? Have you ever seen the tools that a dentist have?
You got it.
Okay. OMG. What does the word tract mean? Pull. They don't make an incision. They just grab it and. So back in the day, that's okay, that's okay. When there was no dentist, who would remove your teeth? Who would remove your teeth back in the days when there was nothing known as a dentist?
Home Depot. I'm just
Nah.
kidding.
The blacksmith. Do you guys know what a blacksmith is?
Blacksmith is someone who molds metal.
Exactly. So the guy who was making okay, horseshoes and things like that. Okay, and that's why I says okay, Home Depot, because pretty much okay, that bill yes, okay, big range looking like thing, yes, okay, that's what you were grabbing your teeth with it. Okay, yes, he got the muscles. Okay, but now he says okay, extraction of tooth. Back then it was just to pull it out. But if you look at it, yes, okay, the word extracting actually came from pulling out. Tract is pull. X is out. Some of you guys may not have looked at the word tractor like that. So I would say it's okay. The main reason that occurs you have the word tractor is because this mean it's okay, something just okay, pull. Pull that thing through is okay, by which is okay, you could. That's okay. Turn over the soil and things like that. Prime is okay because it's used to pull. So the word extract means okay, just means pull out. Did you guys get that? That X is out, tract is pull. Any questions? Nope. So let's just play this game here. We can do it this way. And say it's okay. Ectomy, and if I say nephrectomy, kidneys, oophorectomy, ovaries, salpinx or salpinectomy, fallopian tubes. vasectomy. Now these two here is okay, is just going to be as okay ligation of, or we can call it okay the vas deferens. We can say as okay tonsillectomy, tonsils. Adenoidectomy, adenoids. Appendicectomy, which actually going to be pronounced as appendi. This C combines here, so it become appendicectomy. It's going to be the appendix. Now some people will go col, some people will go as okay colon. So colectomy or colonectomy. Colon. Yeah, okay. We can go pulmonectomy. Removal of the lung. Yeah, okay. We can go next one and says okay, lub. That's okay, yeah, that's going to just okay. Be derived from the word lobe. Okay. So yes, okay, lobectomy will be as okay, the removal of the lobe. Now the main is okay, just 3-4 organs in which we have a lobe. Your lungs, the liver, the pituitary, and okay, yes, in the brain. Okay. If we just use the word same, plain lobectomy, unless and unless specified otherwise, is going to be okay, removal of the lobe of a lung. Whereas if you say it's okay, removal of a lobe of the kidney, liver, so it's going to be as okay, hepatic lobectomy. And of course, as okay, somebody wants to be specified as okay, which lobe of the kidney, lung was removed. Okay, the same as okay, still will apply for the lung. So the may says okay, right upper lobectomy, which means okay, this meant removal of the upper right lobe of the lung. So and so. Did you guys get that? So as long as you know it's okay what the root word means, ectomy of that will just be removal of that. Unless you start salpings, which is the fallopian tubes where we don't really remove anything. It's just 2 clips and a cut in the middle. Or for the vas deferens, 2 smaller staples and a clip in the middle. Oh, yes, okay, just one last one. Oops, sorry. Sometimes it just happens. Likes to do this, play this game with me. Atherectomy. Right, this is going to be is okay, the removal of. Here, this word ether is going to be is okay that body plaque. Okay, now where do they usually is okay perform this? If you had a blood vessels in which we had arteriosclerosis, that means it's okay caused, we can say it's okay, this part of the blood vessel here should become stenosed because of narrowing down of the lumen. Okay, this area is narrower than what you have up here. Okay. So this is, we can say, okay, not stenosed. So what the main is, okay, doing an atherectomy is pretty much, okay, surgically. It's okay, remove this out. Any questions? Please keep in mind, guys, that okay, the stenosis is mainly going to mean it's okay. Narrowing off a structure, which happens here. So narrowing is going just okay, stenosis is going to be narrowing. You may come across a word that is going to be occlusion, or you may even see as okay, occluded. And does anybody know what the difference between stenosis and occlusion is going to be?
It's wide. It's like widen.
No, no. Nobody have heard of the word occluded? Okay, guys. So occlusion. Let's just look here. You can see it's okay. Stenode or stenosed versus occluded. Or we can say it's okay. Stenosis versus occlusion, where the word stenosis just meant narrowed. Yes, okay, it is narrowed. Whereas, guys, if we said occluded, that same blood vessel, yes, okay, it could be occluded. Because it is blocked. Did that make sense? So it's okay. If something is stenosed, you may say it's okay. Well, okay, we go down from 5 lanes on the highway just to 2 lanes because the right 3 lanes were, as long as this case says, okay, blocked. But we still have 2 lanes to utilize, right? Okay. Maybe because of a bad accident. Whereas, okay, if a big tree falls and it blocks the whole way, what do you have now? It's blocked, it's occluded. Okay. So there's no way of us going through that area, right? Okay. So it's okay. A dead end is going to be it's okay occluded. Whereas when you say stenosed, it is going to be it's okay narrowed down from 3 lanes to 2 lanes, or from 3 lanes to 1 lane. But if all 3 lanes are blocked, there's not going to be stenosis, then that will become an occlusion. Did you guys get that? Okay. So there's okay stenosis, there's still going to be flow. In this case, it's okay of blood. If this was a blood vessel. Whereas an occlusion was okay, the flow is stopped. Did you guys get that? So small words, that's okay. It's okay, well, okay. It affects the blood flow, but that's okay. There's a hell of a difference between it's okay how much it is affected. Did that make sense? Good. Graph or gram or Grammy. Now where we say graph, or where we say it's okay, gram, will be the recording. Where if you get it like this, or if you get it like, okay, as a picture. Where we say graph P or Grammy, so it's become just okay, the process of recording. Here. Now, one term that you guys may have heard, and okay, yes, mammography. A mammograph. Where we say it's okay, mammograph, that is going to be as okay, the image. Up here is okay, we said this mam coming from. And it's okay, originally it's okay derived from the mammary gland, but it's okay in this context, it's going to be it's okay, the breast. So a mammograph, that's going to be as okay, the procedure of okay, mainly as okay, creating the image of the breast. Okay. Where the procedure itself will be called as okay, a mammography. Okay. Somebody may have to go and get a mammography. Okay. But what's going to be as okay, the outcome of that is going to be a mammograph. Okay. We even say yes, okay, things such as electro Hugo says, okay. Encephal. Oh. Okay. Or on the other hand, electro. Cardio. Which is going to be this. But the procedure of obtaining is okay, ECG or EKG or an electrocardiograph is going to be electrocardiography. You may hear the word sonograph. Let's say it's okay, sonography. But here not okay as a graph like that, but actually it's okay, image using what you call the sound here is okay, comes from the word sound. So mainly it's okay, just another word for is okay, your ultrasound. And if we talk about it's okay, the part we can mean it says okay, echocardiography. Or graph. Right now, please make sure that you is okay are able to is okay distinguish between is okay and electrocardiograph and an echocardiograph. Because in an electrocardiograph or an ECG or EKG, is okay. This is what you ideally should get. Whereas, okay, in an echocardiograph, okay, you get an image something like this. Okay. And where does this echo come from? I mean, it's okay, come from the sound that is reflected back. Which ultrasound is okay technology use is going to be the sound that you send that will reflect back, that your system will convert into an image. Whether you scan the heart, the liver, the spleen, the pancreas, the kidneys, the fetus, doesn't really matter. Okay, so the word sound here is okay, comes from sonic. Any questions? Okay, we can just take one of the last graph or graph. And he is going to be an angiogram. Now, what is going to be? It's going to be as okay, recording. Okay. And all this, okay, it says gram, but it's okay, it's still going to be it's okay. It's going to be it's okay an image. So you still get a picture. But a picture of what? What did the word angio mean? Or angie? Because here it's okay, always just the combined vowel.
Blood vessel?
Huh?
Blood vessel?
Blood vessel. Okay. But guys, pretty much okay when we say angiogram or when we talk angio, the type of blood vessel that we most likely is okay talk about is going to be an artery. Okay. So that's okay if you, for instance, okay, you may get a similar gram or recording or image of a vein. That would just be called as okay a venogram. Yes, okay, there is no question about the vein is mean that's okay just from the word vein. So angiogram is mean it's okay going to be a recording of the arteries. Okay. And now in a regular is okay, diagnostic imaging is okay. What they actually will do is, I guess it's okay that we have a blood vessel here that needs to be scanned. Or it's okay, we want it's okay, create an image of it. What they will be doing is okay, they will administer is okay, what we call a contrast agent. And what they mainly will see is okay, do is they will follow the flow of this contrast agent through the artery as it is being scanned. Right. Primary is okay to say, okay, any area is okay where they may, for instance, okay, be block is they don't say, okay, this area is okay, you don't have any, that's okay, at least in these areas, there's going to be no filling of the contrast agent and so on. So that kind of test is what they'll call an angiogram. Okay. In some instances, that's okay, it's more common nowadays, is that they actually is okay will introduce a fiber optic tube with okay as a camera on the tip through the blood vessel and come and say, yeah, maybe have a narrowing or stenosis of the blood vessel here. And that's why it's okay, they may go on and okay as because it's okay to do the treatment of that. Okay, we will come to that in just a little bit. Okay. But anyway, it's okay whenever they use the word angio in 99.9% of the cases. Okay, although generally it's okay, talk about blood vessel, but in 99% of the cases, it's going to be referring to a artery. Did you guys get that? Now, next word, lysis. VS, okay, or notice. Cis here is okay, indicate that okay, this word here is going to be process. Process of what? Lie. But here's okay, this lie here actually is okay, comes from the word. We can say it's okay, lice. Or as a whole, yes, okay, lysis. But just let's okay, what does the word lice mean? Breakdown. In some cases, okay, the word lies may also, or lysis, may also is okay be, we can say it's okay, separate. But just a couple of examples, it's okay when we use it in the context of breakdown. You could say hemolysis. Okay, where lysis means is okay was breakdown of blood. I usually is okay when we talk about the term hemolysis, it's mainly going to be okay breakdown of red blood cells. As you're saying right now, each second, hundreds and thousands of red blood cells are being broken up in your body. But your bone marrow mean is okay, just reproduce new blood cells to replace those. But the physical breakdown of old red blood cells is what you call hemolysis. Did you guys get that? We can say another lysis.
Sorry,
Thrombolysis.
did you? Oh, sorry. I was just gonna say, did you write procedure under cis? I just didn't know what that
Yeah.
word said. Okay.
Procedure
thanks.
process. Okay. Now, procedure means is going to be as okay if it's something that we perform. Process means is okay something that the body may take care of it by itself. Okay. But again, it's okay. He says okay. The lysis is me. It's okay. Still going to it's okay. Me. It's okay. I said breakdown. Breakdown of thrombus aura. Or a blood clot. Okay. So that will be as okay what you would call a thrombolysis. Okay. A term that you may not find in your book. Still says okay, breakdown of, and we can see. Okay, that's fine. Mucolysis. And lysis still going to be as okay, breakdown of, and here muco. M-U-C-O. Maybe it's okay, come from the word, or is just derived from the word mucus. Now, who have been suffering from a bad cough this winter?
think everybody, right?
Okay, maybe. Good. So when you go to the pharmacy aisle and say, okay, I've been coughing pretty badly. I need something. They may give you, yes, okay. You say, okay, let's go to aisle 12 and the 3 bottom shelves on the left side. Yes, okay, you'll find something. Now you may find, it's okay, different packets of, okay, different things. But what you mainly see is, okay, when you look at the details, they will say a term mucolytic. Just means something that does mucolysis. So what that means? Something that breaks up the mucus, or what you may call phlegm. Just to make it easier for you to, you can say, okay, yeah, it's okay, cough up. Okay, so those kind of agents or substances that breaks down the mucus will be referred to as mucolytic. Okay, so it's just a matter of, okay, it's putting one and one together. Okay, so you will not see as, okay, the whole work, okay, mucus or mucus-lytic. They just take the, right. So in some cases, okay, you just have to be a little bit, okay, thinking outside the box. What could have been the word for muco? Or what is it that the word muco represents? So there will be mucus. Just a decent word for phlegm or whatever. Okay, guys? Good. Just an economic is okay. Anybody want a good economical advice?
Sure, why not?
Good. And the best mucolytic that probably is okay, won't cost you is okay a trip to the pharmacy, and where you have to just okay pump out with X amount of money, is regular lukewarm water.
Like drink warm water every day.
If you want to put it that way. No, I didn't say hot. Clear, okay. Okay. And it's not going to be warm, that's okay. Just lukewarm. Okay. I don't know about here, but it's okay if you give a Chinese person, anybody Chinese by any chance, cold water, they will look at you and say, what are you up to? It's in their culture or just by nature, it's okay. It's a norm for them to drink lukewarm water. So, good. Any questions, guys? Any questions?
No.
Nope. Good. And let's just go on to our lasties. Okay, where we say it's okay, plast. The word actually is okay, was plast, which figures as a go mean to repair or correct. Whereas the Y just become, yes, okay, the process or procedure of repairing. Clear, okay. Whereas if you say yes, okay, it just became yes, okay, pertaining to the process of repairing. Yeah, okay, now I'm not going to go into yes, okay, those mammoplasties, rhinoplasties, etc. But that's okay, just the plasty that okay is okay, you see in your book, but it's okay that we haven't mentioned yet. But it's going to be it's okay where you can call NGO plasty. Okay. Now, angioplasty is okay. We can have two types of those. But if you just look at them, what are they going to mean? Well, okay, yes. The procedure of repairing, or we can say, it's okay, reconstruct of a angi, which is going to be as okay, a blood vessel. Or more correctly, as okay, in this case, it's okay, it's going to be an artery. Okay. Now, in this case, it's okay, we may have okay as what is plain is okay, just going to be known as an angioplasty. This thing here is okay, back in the days also was called a balloon dilatation. And when would they do that? That we had a blood vessel. Okay. And what they actually is okay will do is okay. Okay, angiography, but it's okay, doing angiography, not only is okay detecting the degree of blockage, but at the same time also says, okay, now since yes, okay, we are in with something which is going to be, it's okay, have a camera. For me, it's okay, just pass that object. And okay, yes, and the tip of this was going to be, it's okay, a balloon. With the main is okay, we'll just inflate. And what that means is okay, we'll just do cause that okay, the blood vessel became dilated like this. Okay, where you can say it's okay, whatever I caused is okay, the blockage or stenosis in the blood vessel actually. Now here you can say it's okay, now the blood vessel is repaired in the sense that okay, yes, the blood flow is restored. Okay, so that's what the SOK back in the day, SOK will call an angioplasty. Now, unfortunately, SOK, what was seen was that sooner or later, SOK, that area that was obstructed, stenosed, that stenosis was rebuilt. And that's just okay, where it's okay. If you look in your book, yes, okay. What was it that they then taught? Yes. That okay, yes. If on this balloon here is okay that we had, which was okay, dilate to reopen the blood vessel. That they have okay, something that looks like a barbed wire. Which the main is okay, will open up and leave inside the blood vessel so that the blood vessel didn't narrow back again. So now I mean, yes, okay, you can still call an angioplasty, but it's okay, they will say it's okay with a stent. So you may from time to time hear that, okay, yes, you knew somebody who knew somebody who knew somebody who had a stent or got a stent. That's pretty much okay as what they do. So the mainly is okay, leave the it's when I say metal, please don't think of okay as actual barbed wires. But it's just designed like okay as it looks like okay as those steel fences. Okay. But it's okay. Once opened up, it's okay, it won't collapse again. Okay, so you can mean that okay, once the blood vessel open, it's okay, it will remain open. I mean it's okay, just ensure that okay, the blood still flows. Now all that is just a second here. All that says okay, just a second here. All that may say it's okay, later development, but it's okay. I heard about it, it's okay, some good 30 years ago, is what they call it's okay, a medicated stent. So what is going to be a medicated stent where they actually is okay, this stent here actually is just coated with medicine or drug made as okay to further prevent build up of atherosclerotic plaques and things like that. Or made as okay prevent the new buildup of that's okay masses that will cause as okay the blood vessels to as okay become re-stenosed, narrowed down again. Did you guys get that? Okay, Justine, before I jump to the next thing, you had a question there.
Oh yeah, I was just gonna ask, so a person that has like a stenosis would get the angioplasty?
Yes. Not always. Because just think of it, my dear, in this way. And well, okay, I'm a personal witness too. That's okay. That in some instances, okay, may not be a good idea to go on and keep on as okay, distending the blood vessel. Okay. And that's why it's okay. I say it's okay. There's going to be as okay another form of it's okay angioplasty. So, okay. Where we mainly is okay, we'll say it's okay that angioplasty, you know, just the most common type is going to yes of F. It's still going to be as okay. Angioplasty is going to be as okay. What we can call as okay C A B G. Okay. Okay, what's going to be difference now? Yes, okay. The CA that's mainly that's okay just for it's okay for the coronary arteries. Okay. Because okay, you can do as okay a coronary angioplasty like this one here, or they can do as okay what they call a CABG. Where we still can say as okay that we for instance okay may have a coronary artery. This coronary artery here is okay. We can say it's okay, maybe stenosed. Okay, now most likely it's okay to a greater extent than we had up here. So that's why you may see as okay, somebody went for an angiography. They confirmed that he or she had a stenosis, or God forbid, that's okay, urinary occlusion. Okay. But okay, the stenosis was okay as too high of a risk or too high of a grade of okay as the blood vessel that actually is okay stenosed. That will be as okay of a greater risk to try to do a traditional as okay angioplasty with balloon, with or without stent. So that's why they actually is okay do the B. And here's okay, the B is going to be as okay what you call a bypass. And what is going to be a bypass, my dear? That's just going to be a form of detour. And how do they do it? With the help of a graft. Okay. Now, in most instances, okay, this graft is okay, maybe it's okay from a vein that they take from your leg, or it's okay from another blood vessel. So me, it's okay, just come this. But what is it does? It bypasses the stenosis or occlusion. And if that is done in occurs in your coronary arteries in the heart, that's what they call as okay a CABG or a coronary artery bypass grafting. So what you mainly will see is okay, well, okay, if there was a big of a blockage or stenosis, or it's okay, God forbid, it's okay, an occlusion. What just happens is that okay, it's the blood that couldn't make its way here due to a blockage, or it's okay, due to a reduced passage, due to it's okay, the stenosis, will be able to just okay drive through the detour here. And that's how it's okay, they mainly is okay restore blood flow to areas of the heart that doesn't receive enough blood. Okay, guys. Now I may ask a dumb question, but where were you in 2004? Or let me be more specific, Christmas 2004. Do anybody remember Christmas 2004?
I wasn't alive.
Some of you may say, it's okay, at that time, it's okay, I was in kindergarten or pre-K or something like that. Somebody may say, it's okay, I remember Christmas 2004, but okay, 25th of December 2004. That's all I remember. Do you guys remember that big tsunami that happened?
I was in elementary school. I don't remember much.
You don't remember much, exactly. Right? Now, not the tsunami, but it's okay. The reason that I remember it, that that very year, or you can say it's okay, Christmas 2004. That was very, yes, okay, or yes, okay. At that time, it's okay, I was working at a cardiothoracic unit. Now, it's okay, down there, that's okay. With by Indonesia, Thailand, that's when they got the tsunami due to it's okay, an extreme earthquake. Okay, nothing like the one we had the other day. This was peanuts. Okay, but it's okay. One of the things about it is okay, extreme earthquakes is that okay, they may produce tsunamis. So that's what they got. But anyways, in Denmark we had a big snowstorm for Christmas that year. And there was one case, and he probably is okay. The whole story was he was expecting guests to come over for Christmas vacation. So that's okay. When you have a big storm, what would you like to do with your driveway? Clear it up, right? So that's what that poor man is okay ended up doing. And whether it was due to just okay the heavy snow or the cold weather or both, but he suffered a heart attack right there. Now was brought in, and what I think okay the cardiology department tried to do in the first place was just okay place a stent. Now somehow that didn't go well. Shit happens. So that didn't go well. Now mainly as okay in the transition from the cardiology to us, nobody really knew what was going on. So we okay later on. That's okay when the dust settled. Yes, okay, we did okay as an audit. How come? Because okay, we didn't have to take him over. But the whole thing was that okay, his blood vessels was narrowed down to an extent that okay, where it actually caused that's okay when they tried to dilate it, they popped. And we now are standing there with the patient, had to open his chest and run a bypass and all that. But then, okay, afterward recovery took more than longer. So forget about as okay the Christmas gifts for that Christmas. He couldn't go home for New Year because he was still sedated. And when we ultimately and for finally is okay, we're able to just okay get him out of sedation. Now the last thing that he remembered was that he had guests coming over. Now what we placed just okay after surgery was okay some tubes into the chest, and it was going to be my job just okay to remove those tubes once he woke up. So when I came back, I said, okay, well, good morning, I have to remove your tubes. And he says, so when can I get home? I say, why would you like to get home right now? He said, because I have guests coming over for Christmas dinner. I said, well, Christmas, that was last year. That was in 2004. Right now we are in 2005. But I said, but I still need to go home for New Year. I said, okay, well, Merry Christmas and a Happy New Year. Because today is, okay, 7th of January, 2005. So, unfortunately, yes. So, yeah. So that's why, Justine, not everybody with a stenosis should get an angiography or angioplasty. Okay, they will go with an angiography, but just okay, determine, you can say it's okay, the extent of the blockage. Okay? Did that make sense?
Yes, because it could burst, you're saying?
Pretty much, yeah. Just think of it in this way. You have a pipeline in your house. Where okay, as whatever has happened, but okay, as something has says okay, you got stuck in it. Okay. Okay, and now you can make it okay, go and say, okay, well, okay, let me just open up the lining of the pipeline by expanding it. But that pipeline is only going to be able to just okay take a certain amount of pressure, right? If you keep on tick, 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 it's going to ultimately at one point up. So the greater the blockage, that's okay, the more that you have to distend it. So that's why they may say no. Either we just run a bypass Okay, but it's okay. In range, that's okay. What they may just say, okay, let's just cut this piece out and replace it with another piece. There are going to be instances, okay, where they may have just, okay, physically remove a blood vessel and may just, okay, replace it with a graft material. Okay. And again, yes, okay, that's pretty much okay as with big blood vessels, that's okay, may have been. What you want to call it, has bursted. Okay. Any questions about the scopes or scopies? Nope. Good. Now, guys, we might have said, show me, which meant cutting into, right? Yeah, okay. We might have said ectomy, which remained as okay, was just as said, just okay. Cutting into and out. Yeah, okay. But here we will talk about, yes, okay, the word stomy. Very can mean it says okay, the Y here mean it's okay, just mean that this is going to be as okay a procedure. Where the word storm or the storm and stomy actually is okay derived from the word stoma, which actually is okay means mouth. Okay, or where the word stomy is going to be as okay. Now the reason that okay they call it a stomy mania is okay because it's going to be as okay a mouth look alike open. Did you guys get that?
Sorry, so the word stomy actually means mouth and
Yeah.
not opening?
No, the word stoma means mouth.
Okay, because in the book it says
I
open.
know what the book says,
Okay.
but the word stoma means mouth. So from the word stoma, that's when they got the word stomy. Okay. Okay. And if you look at the different kind of stomies that we may be talking about, what do they look like? A mouth look-alike opening. So an opening that just looks like a mouth. That's why they call them stomies. Did you guys get that? Okay. Okay.
Thanks.
So that's why they are called stomies. But you can see it's okay, just as okay, one letter in front of stomy makes a hell of a difference, right? Okay, so you put an S in front of stomy, it becomes stomy, which is going to be okay that mouth look-alike open. Now, guys, you may have heard of the word colostomy. Now, why would I call it a colostomy? Mainly because, okay, that's going to be, it's okay, that mouth allowed opening from the colon. So if he says, okay, we have the colon, for instance, here. Mainly because, okay, we have an opening here. Okay, now usually that's okay, what they will do is, well, okay. Okay. Mainly it's okay, take one end of the colon and okay, let's make it or bring it through as okay, an opening in the skin. And okay, temporarily it's okay for a shorter, longer period of time. It's okay, this lower end here is going to be suture or closed. Okay, so that's going to be as okay, a colostomy. Okay, you may hear the word ileostomy, which again is okay, it's going to be as okay, this opening here, which is going to be okay, look like a mouth, and where it's actually going to be as okay, the ileum that opens out through this okay, that ileostomy. You may have as okay, what they will call a jejun. And we can say it's okay, oh, and then the stomy. So it becomes just okay, the jejunostomy. Mainly because okay, a loop of the jejunum is okay, maybe opening up through this mouth look-alike opening called the okay. Okay. In straight in word and it's okay. In some instances, that's okay. You may even have it's okay, what they will call yeah, you mainly it's okay, also okay. Gastric is okay, that's going to be the stomach. And okay, that's where they have made this model-like opening. That leads to the stomach. So that will be as okay, a gastostomy. Okay, now guys, usually it's okay when we talk of a colonostomy. Even it's okay in some extreme cases, okay, if a person has okay as an ileostomy, you can mean it as okay, any part is okay distal to the stomy. In colon, yes, okay, is going to be this. Or in an ileostomy, yes, okay, you can mean it as okay, the entire colon. And okay, whatever big or smaller part of the jejunum is okay, maybe is okay here. Okay. Are not going to is okay be receiving anything because pretty much okay, the contents are going to is okay exit through this stomy. And that's why it's okay from stomy, it's okay, you may hear people having it's okay, what they call stomy bags. Is just going to be as okay, a bigger or smaller bag That means it's okay that they will attach here in case of colonostomy, into which, okay, as the contents from the colon gets out, and mean it's okay accumulated. And from time to time, it's okay, there's got to be opened and emptied into the potty or toilet or whatever you want to call it. Did you guys get that? Okay. Now, sometimes these stomies here may be permanent. Is that clear? Sometimes it's okay, a stomie like that may be permanent. Sometimes those stomies may be temporary. Okay. For a month, 2 months, 3 months or so. Now, when we say that they are going to be temporary, what does that mean?
That you're gonna put it back together and it's not gonna last for long?
Exactly. And what do we call that putting back together? That's
Um,
fine. No, that's okay, because that's what we just can say is okay now. Because okay, will still be as okay. Storm. To me, it's okay, we had a word. Storm, right? Okay. Now that's going to be as okay, that procedure where those stones are going to be as okay, be put together. And what do we call that? Anastomosis. So anastomosis means that's okay, where we say it's okay, we take one stone, we take the other stone, okay, and we pretty much okay, yes, bring them together. But that process is okay, where these two ends are brought together is what you call anastomosis. Okay, so whether that means okay, reuniting the colon with colon, ileum with ileum, jejunum with jejunum, bringing them back, mouth to mouth. I mean, it's okay. Seated with a kiss, that's going to be as okay, what you can call anastomosis. Did you guys get that? Any questions? Yes.
So the stomy is basically made like it's an opening made to like get some of the contents or whatever is in
Just
there
make
out.
an, it's okay. We can say an alternative route for the contents to get evacuated.
And then the stomy bag would be used to collect it.
Yeah. So any person who has, okay, as a stomy specialist, okay, if that stomy is from, yes, okay, you were anything of, yes, okay, you were gut. Okay. Okay.
Thanks.
That means it's okay, would be collected in a stomy bag, which means okay, is just attached onto that stomy, which okay, the person was like, I just need to go for a big job. Okay. So instead of okay, as sitting down, okay, evacuate as he or she otherwise would have done. In this case, it's just a matter of opening the bag and just going to just run out that, and then the maze just can seal it back and just walk back. Did you guys get that?
Yeah.
Okay, guys, now although that's not mentioned in your book here, but since we talked about stomies, or since we talked about anastomosis. Okay, there's just two terms that I just want to introduce to you guys. So please try to look here, guys. So and those two terms, one is going to be what you call let's just do this other one first. Sorry. Sinus. And the other one is going to be, oops, no, sorry. Sorry, guys. Fistula. Now, guys, if you first look at the word sinus, you may think of the word sinusitis, right? Right? Okay. But what the word sinus actually means is bay. You guys know what a bay is? B-A-Y, not B-O-Y. Me and Dennis would know what a boy means. Bay. Yes, Victoria, you are nodding. So do you mind telling the other girls what a bay means?
It's like an opening, like in the water, right? Like a pathway.
Okay. Yeah, but we call the bay areas by the beach or by the area where the people mainly would anchor their ships or ships or boats.
Yeah.
But that's why they call it a bay.
Oh.
So what did that tell you? That that's going to be anything with a dead end. Clear? Okay. Okay. And when we talk about the sinuses in which people may get what you call sinusitis. They're mainly called sinuses because they are dead ends. What does it mean to be a dead end? You travel down a road and but before entering that road it says dead end. What does that mean?
There's no exit after that. Like
You won't be able to go through and as exit or as merge onto another street or road, right? Did that make sense? So it's not going to be a through and through passage, right? Okay. So there actually are going to be structures which may develop as what you can call a sinus. Okay. But if we say yes, okay, if this, for instance, okay, was a structure, and okay, yes, we have this dead end protrusion, meaning it's okay because it ends in a dead end, that would be called a sinus. Whereas on the other end, guys, if we said fistula, now fistula mainly would be, yes, okay, you can say yes, okay, if we have a structure, and okay, yes, it develops something like this, but if that other end ends up in another body passage, this thing here is actually going to be, it's okay, what you call a fistula. So in this, it's okay, for it is, it's okay, A. In case of A, what's a fistula going to be? Because it's okay, a connection between two body passages or structures. Did you guys get that? Another example of what can be a fistula is, well, okay, we can see, and we're just going to name that as being B, for instance. That we may, yes, okay, have a body structure in which, yes, okay, a fistula develops. But this fistula here is okay, mainly, yes, okay, is going to open out at the other end through the skin. So in B, we can say it's okay, it means it's okay, going to be a connection. That fistula is going to be, it's okay, be a connection between, well, okay, yes, a body structure, passage, and through the skin. Okay, whereas, okay, as when we said sinus is going to be, it's okay, a dead end. Now, guys, if you guys remember earlier today, we talked about, yes, okay, pneumaturia, right? Right? You remember that one? Urine. Did you guys remember that one? Clear, okay. So how was that going to be possible? Because of a fistula between the colon and your urinary bladder. Yeah, okay. So what would we call that kind of fellow? So I mean, it's okay going to be because we had a fistula, where in this case, echo says okay. If one here is okay, was the colon. And the other one here is okay, for instance, okay, was the bladder. This fistula here actually will be called colon from colon. And here's okay, the word for bladder is not going to be cyst, but it's going to be as okay, vesicle. Or we can say it's okay, vesicle, because the word vesicle actually is okay, also means it's okay, a sac-like structure, a pouch-like structure with a fluid. So it's okay here for the word for bladder is not going to be cyst, but rather vesicle. And then of course it's going to be as okay, fistula. So colovesical fistula. Right. Now, guys, this is not something that normally happens. Okay. Right. Okay. But yes, okay, it may happen. So maybe it's okay because we have this connection between, yes, okay, the two body passages here, which was the sorry. On one end is okay, the colon, and the other end was, yes, okay, your bladder. Going to be as okay, colovesical fistula. Okay. Where okay, and on the other hand, that's okay. Okay. It's going to be pretty as okay, unusual for the colon to yes, okay, connect through to the skin. Okay. But here it's okay, we can actually say it's okay that we may have, let's say it's okay, the bladder actually is okay, making a connection through, yes, okay, that's going to okay, leak out through the skin. So in that case, okay, we can say it's okay, that would have been that okay, if this here is okay, what's your bladder? And this was going to be it's okay, the surface of the skin. That could be it's okay, that was going to be it's okay, what we're gonna call a vesicle from bladder and cutaneous from skin. And the connection here is okay, what's going to be it's okay, fistula. Did you guys get that? We can also have another example where we can say it's okay, if one, for instance, okay, was the oops, esophagus, your airway, no, sorry, your feeding tube. And on the other hand, it's okay, this one here will be, yes, okay, what you have is going to be, it's okay, the trachea. So this kind of connection here between these two is going to be, it's okay, what we can call it, it's okay, a trachea, from trachea. You can say it's okay, O is a combined vowel. Esophageal from esophagus, eel, just okay, make it, and it can become fistula. So most likely, it's okay, what will happen here is not going to be the air that you breathe in that goes to your esophagus and stomach, not right, other way around. Contents that should have passed through, yes, okay, your esophagus to the stomach makes its way to the trachea. And you may get choked. Did that make sense? Good. Nextus and second lastus. Because, okay, my two, well, okay, not favorites personally, but okay, anyways. It's going to be as okay what we call a fistula in ano. Now, what is a fistula? That through end connection. And where do we find this? In ano, which is from anus. Now, guys, this may get a little bit graphic. But I think that, okay, this is one butt cheek. This is another butt cheek. And we can mainly says, okay, this here is okay, this is the anal opening, where you mainly is okay. Up here is okay, well, it's okay, what we can call it, okay, the anal canal. Now we just have to add a fistula here. This becomes your fistula. Okay. So what is it that we may have? It's okay, another opening here. Through which, yes, okay, it may sound, yes, okay. But it's okay, where actually it's okay. Fecal material may, yes, okay, constantly leak. So that's okay. Somebody may say, no matter how well I try to clean myself, that's okay, I end up as okay, still having staining on my undergarments. Now, probably not the most pleasant thing to come across. Now somebody else, okay, something that somebody else, okay, really wants to fix, but that's okay, there's a great risk because, well, okay, it can get fixed, but that's okay, a slight mistake may cause that the person is going to be permanently fecal incontinent. So not just slight staining, but that's okay, will not be able to hold back any poop at all. So yeah. Yeah. But that's what you call it, okay, a fistula in ano. Okay, when you guess, okay, it's going to be as okay, an anocutaneous fistula. If you don't like the word fistula in ano, because okay, it sounds, it's too graphic. Well, okay, you can still say it's okay. Anocutaneous fistula. Now, guys, it's not always that, okay, fistulae are going to be bad because there's going to be a type of fistula. And we mean it's okay, we just call it as okay, the AV fistula. Where, guys, please, just okay, the word A stand for artery. You have O as a combined vowel. And V is okay, is for Venus. Okay. And what would that be? If this, for instance, okay, was an artery, and on the other end we say, okay, this was a vein, then okay, yes, this would be a fistula. Or maybe it's okay, just a connection between the artery and the vein. But these are, if required, surgically constructed. So AV fistula mainly is okay. People who go for hemodialysis will have an AV fistula, or will have a couple of them. And some of you say, why? Because this is made as through the fistula that actually will be get hooked up to the hemodialysis machine. Did that make sense? Okay, so this is not going to be something that the person is going to be born with. That has to be surgically constructed. They actually have a surgeon coming in and taking an artery and a vein and joining the ends together. Or because that's here is create a mouth and then anastomose them. But create that connection between the artery and the vein that we call an AV fistula. Did you guys get that? Now you may, just a sec, my dear. Now you may be saying, well, the patient has fistula on right arm and left arm. It's not going to be both of these which will be working, because the right arm worked, and why would we have one on the left arm, or vice versa? They usually make them on the arms. Okay. But one thing that you guys will have to remember is, do not take blood pressure on the arm that has a working fistula. That will destroy it. That was probably what happened in the first place, because he had one on the left arm. That somebody took his blood pressure on the left arm where he had a fistula, and that got destroyed, and now they had just make another fistula on the other arm. Clear? Okay. If at any point it's I don't know, maybe some of you may have a change of mind at some point, but it's don't take blood from that arm with a functioning or working fistula. Now, how would you know whether a fistula is working or not? Your hand. You place your hand on it, and if it's working, you will feel that thrill. So you actually will feel a thrill on the fistula if it is working. Okay. If you say, I can't really feel much because I don't have a good sensation in my hands, you can always listen to the fistula. Not like this, but with a stethoscope. And what you will hear is more of a rumbling sound. So checking on a fistula is just like checking on a purring cat. Somebody has a cat or cats. If that cat is purring, what does it feel like? That tremor. What does it sound like? The sound that you will hear. And if somebody say, well, I'm not a cat person, well, okay. Cat person or not, it's okay. I still hope it's okay. Do you understand? It's okay. Know what the feet is okay. What a purring cat sounds like, or what it feels like. So yes, okay, guys, with or without. Okay. So just take your lunch break, and when we come back, it's okay. There will just be a few terms in chapter number 4 that I want to go over you, and okay, we can say we somehow finished off with our medical terminology then, okay? Capish? Good. So should I say that see you guys back at 1 o'clock? Would that be a fair deal? Okay, have fun till then.
Thank you.
You're welcome then. Okay, guys, welcome back. And okay. So chapter 4, just a couple of terms that, okay, yes, we might have. Okay. Again, it's okay, we say it's okay. Suffixes. And for instance, okay, prefixes. Now, guys, any question about A versus N? Which means we know none. You can say okay, without or the absence of. And where we used A if the root word starts with a consonant, and N if the root word starts with an vowel. Clear? Okay. So just an example. Apnea. No breathing. You earlier said and anemia. Okay. That's another example. We can say it's okay. And here it's okay. The word is orex. And then ia. Okay, so ia just becomes yes, okay. Still a condition with no other absence of orex, which is going to be yes, okay, appetite. Okay. We earlier said amenorrhea. No menstrual flow or discharge. Just another one. We say it's okay, A, which will mean it's okay, would mean the absence or without or. And here's okay, the word is needs here, where it's going to be a condition, and okay, here's what MNANE is going to be, is memory. Okay, so you may say, okay, loss of memory for a shorter or greater period of time is what you can call amnesia. Okay, it's going to be pronounced as amnesia. So you mean yes, okay. As far as the pronouncing is concerned, E and M, and then you just go NES and then E. So amnesia. Did you guys get that? Okay. Now just two other suffixes, which means okay, will mean the opposite of one another. Is going to be ab and ad. The word ab is going to be, sorry, away from. Now, okay, guys, there's going to be a motion or a movement. And you can take that off as if you talk of an arm, or even as okay, a leg. Or we're just going to stick with the arm. It's going to be a little bit difficult for the leg. So pretty much okay, yes, this movement here is going to be as okay, what we will call abduction. Or me standing like this. Clear, okay. But if I move my arm like this, there's going to be as okay, abduction. ABDUCTION. Okay, because I'm moving the air, I'm moving my arm away from the body. Yeah, okay. Just think of it as okay, kidnapping. Another word for kidnapping is also abduction. And what do you, or why mean? Yes, okay, because you take something away from the person to whom it belongs. Okay. Did that make sense? Okay. There may be another word that we okay may use ab. And that's going to, you can say it's okay, abnormal. So here it's okay, normal is normal. Ab is okay, yes, away from, or yes, okay, you can say it's okay, something which is, in this case, is okay, this is okay, not normal. Or kept away from the normal. Clear? Okay. Whereas on the other hand, guys, add, yeah, just okay, as with one D, is going to be as okay, what we can say is okay, near, or if you want to call it, okay, close by. Now, guys, if this motion or movement of your arm, for instance, okay, is going to be called abduction, then the opposite motion, where we is okay, are going to is okay, bring the arm back like this, is going to be called abduction. Did you guys get that? So if, for instance, okay, if my arm, in this case, is okay, it's going to be as okay, the shoulder joint at that moment is going to be accounted to. Okay. Is going to be as okay, abducted. But if I bring it back like this, that is going to be adduction. ADDUCICON. Okay. And a cheat that I used back in the days was this. I say add is okay, I thought of okay as literally as okay addition. Where you add numbers, that's mean it's okay when you put numbers together, right? Did that make sense? So that's okay. If you put your arms together to your body, that's going to be as okay adduction. That's how I thought of it. Yes, okay. So just a little cheat, yes, okay. It worked for me, it's okay. In some cases, okay, it may work for you. All this, okay, your book talks of, yes, okay. Adrenal. And we can basically just say it's okay, the adrenal gland. But why do we call it the adrenal? Mainly because if this is okay was the kidney, which in this instance is going to be referred to as renal, or use adrenal, or as okay, renal. The add is made as okay because it's nearby the kidney. Actually, it's okay, it's going to be on the top of the kidney. But the main says, okay, we found something as okay close by or nearby the kidney. What are we going to call it? Just call it close by the kidney. So that became add, close by or near, renal, but changed to the kidney. And what we later on found out that okay, as there was a gland. Did you guys get that? Now just a word here, guys. And that is going to be Anna. Please keep in mind, this is going to be a okay prefix. Now tomorrow, we may talk of occurs if we have class tomorrow. If not, Wednesday.
I was just wondering, you said you would email us to let us
I will
know?
email you guys,
Okay, thank you.
but I can't email you before I know it myself. So here's okay, the word Anna actually as okay means up, or rather as okay, apart. Okay, so what is it that the word, what actually sort of becomes anatomy will mean? Cutting apart. Okay. We can also say yes, okay. Anna lysis. And this was breakdown. And again, yes, okay, here will mean part. Okay, so actually it's okay, what would be what we call an analysis is made as okay, if you look at a problem, how is it that you analyze it? Pull the things that made the problem apart and look at them at one by one. Or in all this, you can even say, okay, that there will be something that I call is okay. Oh, shit. No, actually, it's okay. It should have been just okay. Urine analysis. But it's okay. What they just did is like this. Or urine analysis. Okay, so urine analysis. Okay. So earlier is okay. When I talk, is okay. What are the things that you can find in the urine? That means okay, done by it's okay. What you can call it's okay. Urine analysis or urine analysis, as the media is okay, just abbreviated as. Okay, guys. Some other terms. And we can say it's okay, Brady. And just so you know that okay is the other is going to be tacky. So Brady is going to be slow. Tacky is going to be fast. Now pretty much okay is just two different terms for Brady and two different terms for tacky. That may become yes okay. We can say it's okay clinically it's okay or practically it's okay. Relevant. Brady cardia. Okay. So when your heart beats slower than normal, that will be as okay what we will call bradycardia. Whereas okay as if the heart beats faster than normal, that will be tachycardia. Okay. Another thing that may happen slower or faster can be brachnia. So slower breathing than normal and tachya. Faster breathing than normal. Right? Did you guys get that? Okay, now we talk more of tachycardia, bradycardia, the definition of those, what is lower than normal, what is faster than normal. Beating hearts when we get to the cardiovascular system. Okay, guys? Good. Any question about this? DYS. Nope. Okay, guys, have any of you ever thought of that this is okay may become is okay bad, or we can say it's okay normal, which maybe is okay translate as okay converted into this. Or the word disease came into being. What does the word ease mean? I see somebody who is at ease right now. Who is at ease?
Relaxed.
Relaxed. Okay, good. So who is at ease? So what would the this mean? Not at ease, right? Does that make sense? So just remember that's okay. The last time you were sick, that made you not being at ease. Clear? Okay. Good. Okay. For me, that's okay. The word could mean is okay. The word this could mean bad. Or something to be bad, it's okay, mean it's okay because it could be painful. Or it could also it's okay mean difficulty or difficult. Now, why would something be difficult? Again, it's okay because it was painful. Why could something be bad? Mean it's okay because it was not normal, it was away from the normal, abnormal as we may call it. Okay, guys. Now, next word will be ek. We can actually say it's okay, ectopic. Where the word ek or act, ex is okay, is from out. Now, usually it's okay when we use the word ectopic. You mean it's okay, we'll say that that's going to be, we can say it's okay. Outside the normal. Usually it's okay when we use the word topic, it's going to be it's okay location. So, two examples that you may come across is going to be it's okay a pregnancy. Where pregnancy is okay develops anywhere but in the uterus will be considered an ectopic pregnancy. Okay, common example for that is going to be okay what they'll call is okay tubal pregnancy. That actually is okay developed, or that's the fertilized egg, or the pregnancy actually is okay develops in the fallopian tube. But okay, this got to be terminated. There's no way it's not going to be able to survive. So, okay, and there's probably no way by which it's okay it can be brought back or brought down, and okay, it's implanted in the uterus. Okay, so for me, it's okay because it's outside the normal areas. Okay, where pregnancy will occur. That's why we call it a ectopic pregnancy. Another time, okay, okay. Another term is okay where we may as okay come across the word ectopic. Going to be okay what we can call is okay an ectopic focus, or multiple is going to be foci. Now this is mainly as okay going to be in the heart. Okay. And without going into a lot of details about what that would be, but they're going to suggest, okay, there may be areas in the heart that like to produce those electrical signals that controls the beating of the heart. Outside, it's okay, what we refer to as the normal conduction pathway. So those areas are going to be referred to as an ectopic focus. Clear? Okay. So we can talk more about those when we get to the anatomy and physiology of the heart. Okay, ec. No, we already did that one. Endo. Inside. Okay, we said endocrine, we said exocrine. Okay. Okay. What else did we see? Yes, okay, all this, okay, and endoscopy. Okay, endoscopy is okay. Generally, it's okay. When they talk endoscopy, they talk about the chest. That's okay, where they visualize the inside of the stomach with help of a camera and scope. Clear? Okay. It's epi. Now, above or upon. Epinephrine. Just another name for your adrenaline. What was adrenal? Ad was close by and near. Here they went more specific and say epi, above. Okay, in adrenal, that's okay, it was. Ren was kidney, here nepher is kidney. In mainly is okay, indicating that this is a substance. Chemically, is okay, protein in nature. But it doesn't function, that's okay, we already mentioned that earlier in another class or session. Okay, we said epidural. Now, what do we call an epidural? Epidural is what you can get. Mainly, it's okay, you can say it's a spinal blockage or a spinal block, right? But it's okay if you bang your head and fracture your skull. You make head, okay, yes, and please say it's okay, you fracture your skull. There's, yes, okay, the skin is still intact. That bleeding bone, it may sound crazy, but that blood from, yes, okay, from the fractured bone may actually, it's okay, bleed and accumulate in a space atop of your dura matter. So that will be epidural because it's outside the dura, on top of the dura. But since it's okay, in this case, it is a collection of blood, becomes a hematoma. Okay, so that's okay. And some people, that's okay, they bang their head, okay, yes, whatsoever. And okay, maybe a day or a couple of days later, that's okay, they may start acting weird, confused, delirious, or so on, so and so. Okay, it can be due to a concussion, and or it can be, it's okay, due to a epidural hematoma pressing up against the brain. Did you guys get that? But why did we call it an epidural hematoma? Because a hematoma or a collection of blood or a mass of blood on top of the dura. Did you guys get that? Oopsie. No, that was not what I intended to do. Okay, guys. Why are you doing this? Am I half? Okay. There may be, it's okay, another word that also means half, which is still going to be mi. Okay. But it's okay, where the first letter is going to be, it's okay, replaced, and that's going to be semi. Okay, so this also is okay, will mean half. As if you think of sport events, what comes before the final, the half final? So the semifinals, right? What comes before the semifinals? The quarterfinals, which is half of the half. Clear, okay, and usually it's okay. What comes before that? Just the qualification rounds. Okay, so they will end up as okay, 8 teams that have to compete against one another in the quarterfinals to get into the semifinals. And then semifinals, that's okay, whoever wins on the semifinals will compete against one another in the final. But another word for semi or hemi, another word for hemi is going to be semi, another word for semi is going to be hemi. And they both mean half. Pretty much okay as in the very beginning. I say yes, okay. Hemisphere. There's okay here. Sphere, mainly is okay. So something is okay around the surrounding, which is going to be half. So something which is half circle is going to be a hemisphere. You can, for instance, okay, in this instance, say cerebral hemisphere. So the other day is okay, when I was taking out the brain of Bob or Jack or whatever you want to call him, that was, I mean, it's okay, just a sample of one cerebral hemisphere that was able to just okay take out of his or her or of his skull. Okay, and you can say it's okay. The other half is okay. Yes, okay, we're remaining there. But that one half of the brain was called that's okay, the cerebral hemisphere. Okay. Usually it's okay when we remove not necessarily half, but just part of the colon that can be as okay, huh? Hemi for half or part. Col from colon. And then ectomy.
I'm sorry, what does fear mean?
Sphere, pretty much something which is round in shape. Not exactly round, but more like, okay, oval or egg-shaped. Okay, so that's what B is, okay, what you would call a sphere. Okay, but in some cases, okay, it can also be referred to as, okay, the surrounding. It's just like you say, it's okay, the atmosphere. So what would be the atmosphere? Where you are, what you are in right now. The atmosphere of the class or the atmosphere of the classroom or the room that you're sitting in. Okay, that would be the atmosphere. But of course, okay, that can be related to a lot of things. Okay, you may feel some good or bad energies. You may feel that, okay, it's too hot or cold or something like that. Did you get that, dear?
Yes, thank you.
No problem, dear. Now another word. Hemiplegia. Where hemi is going to be half. The E here is okay, just case that this whole thing is okay, becomes a condition. And the word pledge or plegia mainly is okay, the word that we commonly is okay, today is okay, referred to as paralysis. Okay, but they will call it as okay, hemiplegia. Mainly is okay if you look at the body of a person. Where okay, as he or she may be paralyzed on one side or on the other side. So that will be referred to as hemiplegia. Did you guys get that? But if you are paralyzed on the right side of the body, it's because the left side of your brain is affected, or vice versa. Okay. Now, guys, just a few hypers that I wanted to just okay distinguish between. And I wanted to go to just not really says okay hyper. Now we can just say okay that the opposite of hyper is going to be hypo. And in some cases, okay, extremes of hypo is going to be E. Where hyper, the bow, hypo is below, and A is going to be none. Now, guys, you may see a term that will be okay, hyperplasia. Okay. Yes, okay, from the ending, that's okay, it's going to mean that this is going to be a condition where there's going to be a okay increase. But the word plus here is okay. In this instance, okay, is going to be number of cells. So pretty much, okay, guys, when we have a structure where the number of cells just starts to, yes, okay, increase. That increase of number of cells is going to be as okay, hyperplasia of that structure. Okay, although probably not going to be as okay seen by as okay on the opposite side, you can say it's okay, hypoplasia. Where you actually is okay, just will have a decrease in the number of cells. We can mean as okay, mean yes, okay, due to, we can say it's okay, death of cells. Whereas, okay, if we take as okay, or you can call aplasia. That's going to be no production of cells. So in that case, we can say, okay, for instance, A, that's going to be aplastic or aplasia. You can say hyperplastic, hypoplastic, and aplastic. Okay, an example of aplastic is going to be as okay, what we'll call as okay, aplastic anemia. And what did that call? What did that mean? That the person actually is okay, got anemic, mainly because his or her bone marrow was not able to produce blood cells. Did you guys get that? So that's why we call it okay, aplastic anemia. When there's no okay production of cells. Whereas if that production is too high, okay, that will be as okay hyperplasia. Where if it's too low, it's going to be as okay hypoplasia. But most likely as okay, you're not going to come across the word hypoplasia. But just another term, yes, okay, where we still, yes, okay, will use hyper. And it's okay. Yes, okay, we will use the word hypo. And what I mean is says, okay, that an extreme form for that is going to be E. And that's going to be when we say hypertrophy. Now from hypertrophy, you can get hypertrophic. Just from, yes, okay, hyperplasia, you can get hypo or hyperplasic. And so and so. Okay. But what would it mean to just okay be hypertroph? It mainly is okay that not the number of cells, but actually it's okay the size of the individual cells increase. Whereas okay, if you said hypertrophic, that the size of the cells actually is okay decrease. Whereas I would say as okay, atrophic is just going to be as okay the extreme or atrophy or atrophy. It just becomes okay atrophic. Where you mean it says okay that the cells pretty much okay shrink to yes okay. Okay, so we can say okay, extreme shrinkage in size. Okay, so where will we see atrophy? Muscles. Where can you see hypertrophy? Again, yes, okay, also in muscles. Okay, what would be an example of hypertrophy? Arnold Schwarzenegger, right? Okay. Whereas on the other hand, it says, okay, atrophy is okay, somebody who pretty much okay lost their muscle mass. Did that make sense? Okay. Now, guys, if we just look at the word hyperplasia, because we can mainly say it's okay. Now, what may cause this? Because like I said, okay, a structure is okay, it's growing or it's developing, but we can take and say it's okay, there's going to be something that we'll call neoplasia. And plasia mainly is okay, it's still going to be it's okay that there will okay be an increased number of cells. But where the word here neo means new. Okay. And from this neoplasia, is it that we actually just okay get the term? Sorry, maybe I should choose a different color. Neoplasm, which is mainly as okay just another term for, or we can call it okay malignant tumors. Yeah, okay. And why do we call malignant? If you just look at the word here. Mal means bad. And the word ignorant actually is okay come from ignition, which means okay it's to start a fire. Mainly is okay because once it started, it's okay, it's going to spread like a bad fire. That's why we call it okay malignant. Okay, so all cancers, actual cancers, or what we can call it okay carcinomas or sarcomas, or some of our regular omas, which were cancers, are going to be as okay what we'll call malignant tumors. Whereas the opposite of that was going to be as okay what we can call Ben, and then it's okay the same line.
That's LYN or GYN?
It's IgN.
IGN?
Yes. So if you put it together, my dear, it's going to become B9. But the way that we pronounce it is going to be B9. Okay. Where here's okay, the verb Ben. Mainly as okay means friendly. So that's why some people may even refer to as benign tumors as friendly tumors. Does that make sense? But you can say it's okay, it's still a fire, but it's under control. A bad fire is a fire which gets out of control, right? Okay. Right. So another word for yes, okay, for your malignant tumors can also be neoplasms. And why neoplasm? Because they are going to be neoplastic. New production of cells, which in this instance are going to be cancerous. Did you guys get that? Now, some of you may have heard of it. Some of you might, God forbid, even have experienced it, but there's okay, there's a thing that we call bad or mal area. Now, this may sound like, okay, yes, the name of a girl, but that's not where it comes. They actually is okay, we can say it's okay, condition because it's ear, and here's okay, the AR is mean is okay, referring to ear. So what they thought of that, okay, as what we now know as malaria. Now, the reason that they call it malaria is mainly because they thought that it was due to bad air. Clear? Ever since then, have we got to know that no, it's not due to bad air, but it's actually just okay, a parasite that causes malaria. But what is it that we are? What are we? Too lazy. Too lazy to just okay, give that malarial parasite or that disease as okay, another name. We say, okay, F it. We're going to stick with bad air. Okay. Can you get malaria here in Connecticut? Just a question.
No. No.
No. Why?
Is- Go ahead. I was gonna say because you can only get it in certain like regions or
Okay, good. Mainly because we can say yes, okay, the mosquito that transfers it is not going to be able to live in the environment or the atmosphere that we have in Connecticut. It's too cold up here. Let's put it that way. Yeah, okay. Whereas, okay, a lot of tropic countries, yes, okay, there's a lot of malaria. Matter, we talk about that when we get to the, okay, neo, we already said. The need for para, okay, good. Good, yeah. Jackie, we already did. Retro, we already did. Artery, trans, we already did. Ultra, we already, okay. Good. Yes, guys, that was all I could offer for chapter number 4. What a day. Okay. Now in chapter number 5, I know that you guys may be saying, what do we need to know about that on chapter number 5? And pretty much, okay, we have already, yes, okay, runningly be talking about it. But guys, if you look Okay, in my book it is 177. Page 177. Medical specialties and areas of practice. That's all you need to know from chapter number 5. Did you guys get that?
Did you say 157?
177.
Oh, we said 157.
No, 177. In my book it is, but mine is okay a little.
I think for us it's 178 and 179.
Okay, but they said medical specialties and areas of practice. That's pretty much okay, yes. But if you look at them, we probably have okay been mentioning 90% of these terms here as we went over different body areas or all the logies, right? Or logists and so and so. Okay. So as long as you know it's okay the root word, that's okay. Most of them is going to be straightforward. Okay, guys. Okay, now apropos the next 2 days. Now tomorrow before, okay, we can do this.